Hey there, ShockDoc Medical family. I'm Dr. Raad, and welcome back to another episode where we break down the latest in medical breakthroughs and health tips like we're just chatting over coffee. Now, let me ask you this. Have you ever thought that whooping cough was just a childhood thing? Well, buckle up, because today we're diving into why adults can and do get whooping cough, and exactly what signs you need to watch out for. This isn't your run-of-the-mill cough. It's a full-blown, disruptive infection that's making a comeback. Today's episode is inspired by an eye-opening article titled, Yes, Adults Can Get Whooping Cough. Here are the signs to look out for, published on February 13th, 2025. Despite being largely thought of as a childhood disease, pertussis, or whooping cough, is staging a resurgence. And trust me, when the numbers start climbing, more than 6 times the reported cases in the final week of 2024 compared to 2023, and totals soaring past pre-pandemic levels, it's something we all need to know about. So let's unpack this together. All right, let's get into the nitty-gritty. Whooping cough is caused by the bacterium Bordetella pertussis. Now, most of you might remember this as the reason behind the iconic whoop sound that sometimes accompanies these intense coughing fits. But here's a twist. Not everyone with the condition actually makes that signature sound. According to Mark Loafman, MD, MPH, a family medicine physician specializing in infectious disease at Cook County Health in Chicago, whooping cough is marked by such powerful coughing fits that you literally struggle to catch your breath. Imagine coughing so hard that it feels like you're gasping for air with a high-pitched whistling sound on the inhale. That's the kind of intensity we're talking about. Now, here's something interesting. The pertussis vaccine, which we started using back in the 1940s as part of our routine childhood immunizations, brought cases way down. The CDC recommends a series of shots protecting against diphtheria, tetanus, and pertussis, commonly given as DTaP, for infants, kids, and adolescents. But, and it's a big but, even if you got all your shots as a kid, your immunity can wane as you get older. And here's why it matters. Pertussis boosters aren't officially recommended for adults in the same way, which means that as we age, we might be more susceptible, especially when outbreaks hit. Let's talk symptoms. Early on, pertussis in adults can mimic a common cold. For the first week or so, you might experience congestion, a runny nose, watery eyes, a low-grade fever, and a mild cough. Now, if you're thinking, hey, that sounds like a cold, here's where it gets serious. After about a week, the cough starts to evolve and can become extremely severe. In the second week and beyond, you might face frequent and intense coughing fits, what the experts call spasmodic or paroxysmal coughs. During these bouts, you might struggle to breathe or even produce that high-pitched whistling sound on the inhale. Cough up a lot of mucus. Feel dizzy or, in extreme cases, even pass out. Experience severe fatigue, difficulty sleeping at night, and even vomit. This isn't just an annoying cough. It's your body's inflammatory response to the toxins released by Bordetella pertussis. The bacteria latch onto the tiny hair-like projections, cilia, in your respiratory tract, releasing toxins that trigger inflammation. And even when your immune system eventually clears the bacteria, that inflammation can stick around for weeks. Now, I've seen patients come in thinking they just caught a cold, only to later find out it was whooping cough. And trust me, it's no joke. Prolonged coughing can lead to some serious complications. We're talking about broken ribs, a collapsed lung, or even hernias caused by those relentless coughs. Plus, though it's rare in adults, there's also a risk for pneumonia, brain inflammation, encephalitis, and seizures. What's really concerning is that while doctors might dismiss a cough in its early days, especially when it looks like a common cold, in areas with rising cases like Washington and California, they're now testing sooner. This brings us to the next point, diagnosing whooping cough. So how do we figure out if it's really whooping cough? Initially, since the symptoms mimic a cold, doctors might not run tests if you've only been sick for a couple of days. But if your cough lingers beyond 5 to 7 days, or if it gets intense, it's time to see your doctor. They might perform lab tests by collecting a sample of fluid from the back of your nose. Think of those long swabs you remember from the early days of COVID testing. Or sometimes they use an aspiration technique. The sample is then tested via a bacterial culture to check for Bordetella pertussis, a PCR test that looks for the genetic material of the bug. In some cases, a multiplex PCR panel that can test for several pathogens at once. Heads up though, the multiplex test might be pricey and isn't always fully covered by insurance. But if you're in an outbreak area or your symptoms are severe, these tests can be crucial for a timely diagnosis. Okay, let's move on to treatment because getting this right early on makes a big difference. If you're diagnosed with whooping cough early, meaning within the first 3 weeks, your doctor will likely prescribe an antibiotic to nip this thing in the bud. The go-to antibiotic is azithromycin, also known as a Z-Pak. Now, let's talk dosages for a minute. Typically, for adults with pertussis, the regimen is azithromycin 500 milligrams on day 1, followed by 250 milligrams once daily on days 2 through 5. That's a 5-day course that helps reduce the bacterial load and curbs the risk of spreading the infection. By the end of the course, you should start feeling better, although, keep in mind, the cough might linger because of the ongoing inflammation. But here's an important caveat. If you get diagnosed after 3 weeks of persistent coughing, your doctor might hold off on antibiotics. At that point, the bacteria might have already been cleared, and what you're left with is your body's prolonged inflammatory response. In those cases, there isn't much in the way of medications to smooth out that bad, rasping cough. Over-the-counter drugs haven't shown much promise either. So, the best remedy then becomes rest, hydration, good nutrition, and, most importantly, time. And if your symptoms worsen or just won't go away, definitely follow up with your doctor. Now, prevention is where we can really make a difference. First off, if you didn't get your childhood series of pertussis vaccinations, it's crucial to get vaccinated. The combined Tdap shot protects against tetanus, diphtheria, and pertussis. Even if you were vaccinated as a kid, remember that immunity fades over time. Although the CDC doesn't currently recommend routine pertussis boosters for adults, they do suggest a TD booster every 10 years. Increasingly, many healthcare providers are offering the Tdap shot to adults as well, given the resurgence of whooping cough. There are some special groups to keep in mind. High-risk individuals. If you have asthma or chronic obstructive pulmonary disease, COPD, getting vaccinated is especially important. Pregnant women. The CDC recommends that pregnant people receive the Tdap vaccine between 27 and 36 weeks. This not only protects you, but also passes on vital antibodies to your newborn until they're old enough to get their own shots. Post-exposure prophylaxis. If you've been exposed to someone with whooping cough, say you live with them, or have been in close contact, your doctor might prescribe antibiotics as a preventative measure, given that the incubation period can be as long as 3 weeks. Taking prophylactic antibiotics within that window can stop you from falling ill. Listen, I remember a patient, a middle-aged guy, let's call him Mike, who came in with what he thought was just a bad cold. He was coughing non-stop for over a week, and by the time he finally saw his doctor, it turned out he had whooping cough. He ended up needing the full azithromycin course, and even then, that cough stuck around for a few more weeks. It was a real eye-opener for him. And for me, it underscored just how important it is not to dismiss persistent symptoms. So if you're out there and you've been battling a cough that just won't quit, even if you think it's just a cold, do yourself a favor and get it checked out. Better safe than sorry, right? All right, folks, let's wrap this up. Today, we learned that whooping cough isn't just a childhood disease. It's a serious infection that's making a comeback in adults, with cases skyrocketing in recent times. From the initial cold-like symptoms to those intense, uncontrollable coughing fits, and from diagnostic challenges to effective treatments with azithromycin. 500 milligrams on day 1, then 250 milligrams on days 2 to 5. There's a lot to keep an eye on. And don't forget about prevention. Getting your Tdap shot and being mindful of your surroundings can really make a difference. I hope you found this deep dive as fascinating as I did. I'd love to hear your thoughts, questions, or even your own experiences with persistent coughs. Drop a comment below, and let's get the conversation started. And if you enjoyed this episode, make sure to hit that subscribe button and give us a like. We've got plenty more groundbreaking topics coming up, so stay tuned for our next episode where we'll explore another medical mystery that might just change the way you look at your health. This is Dr. Raad, signing off from ShockDoc Medical. Stay curious, stay informed, and take care of yourselves. Catch you next time.